Hello, friends and neighbors. Welcome to the very first YouTube Live by the American Diabetes Society. I am Dr. Ken Berry. I'm a family physician. I've been practicing family medicine uninterrupted for over 22 years. And in that time, I have helped maybe a few hundred people reverse their type 2 diabetes in my private practice. But now with my YouTube channel and other social media presence, I've helped thousands, maybe tens of thousands. I don't know. Some people say it's tens of thousands, but I don't know. And joining me today is one of the ADS's registered dietitians, Shannon Davis. Welcome, Shannon.
Well, thank you for having me. It's a pleasure to be here.
It's a pleasure. So you guys are going to have to endure two Southerners today. I'm in Tennessee and Shannon's in Georgia.
Yes.
We're loud and proud Southerners, and I think if you'll stick with us and watch this video, you'll realize that maybe some of the preconceived notions you had about Southerners might be false, or they might be true. You'll have to judge for yourself. Shannon, what had first attracted you about the American Diabetes Society and made you say, you know what, I really want to be a part of that?
You know, I've been a dietitian for 18 years. I've worked in organ transplant, liver, kidney, pancreas, and we can talk about what a disaster that was. Did a year and a half in bariatrics, which was even worse. And then the rest of my career has been in nephrology. So, you know, in the dialysis clinic as a dietitian, and then 5 years in pharmaceutical sales. So my whole career has been helping people exist, just band-aid their condition. And every single one of the people in this population that I work with are sick. No one wants to be sick. They're on a ton of meds. They are all insulin resistant. And yet what we're doing, my interaction with them, the doctor's interaction with them, their surgery, their time in a dialysis chair, nothing is getting them better. And so looking at the paradigm of what we're teaching these patients is not right. We are not helping them. And so 2018, I sort of went down the rabbit hole. And for those of you who have gone down, you understand once you go down, you just go deeper. You do not come out. And you start to, it's like the wool has been ripped over my, pulled away. And it's like, how can you not see what you and I see, Dr. Berry, is that diabetes type 2 is a disease, and I think you have said this, of carbohydrate toxicity, a disease of our body's inability to handle carbohydrates. So then, and too much insulin. So we have too much insulin and we're unable to tolerate or metabolize carbohydrates properly. So then anybody in their right mind would think, so why are we still eating carbs and injecting insulin? So that's why I'm here, because the way we're treating people is not working. It's keeping people sick, and we have to do things differently. And I was so incredibly thrilled and just so happy to see here is a society, here is a group of individuals that have the same mission and passion. Really, it's why you're a doctor, why I'm a dietitian, is to truly heal people and help people. And if we don't teach people the truth and the right path, there's so much information out, people don't know where to go. And now we have somewhere they can go.
Absolutely. I love that. And when you said go down the rabbit hole, I think that's an apt analogy. I like to think of it as shifting your paradigm. I think everybody's probably heard the old tale about the blind men who are trying to figure out what an elephant was, right? And so one guy was rubbing the elephant's side and he's like, this is a wall. It's obviously a wall. One guy had a hold of the elephant's tail and he's like, no, you idiot. This is a rope. Of course it's a rope. What are you talking about? The other guy had a hold of the elephant's leg and he's like, this is obviously a tree. What are you guys talking about? And I think that in medicine, we fall prey to that kind of thinking. We're so close to the problem. We've been so tightly trained and the standards of care are so tight and so stringent that we're just right up on the elephant, and we can't back up and take a circumspect view and go, no, wait, this is not a wall, this is not a tree, this is not a rope.
Yeah.
All these things are connected. And so one of the many things that the ADS plans to do is reach out to doctors and dietitians and say, hey, please reconsider your preconceived notions about both type 1 and type 2 diabetes and every other variant. Please reconsider your current paradigm that the treatment of choice for somebody with type 2 diabetes is to give them 1 or 2 or 3 prescriptions, inject them with insulin, inject them with other things. Please reconsider that, because in my opinion, most doctors and dietitians are just too close to the elephant. They've never allowed themselves to back up and look at the whole thing in its totality. And that's what you meant by going down the rabbit hole. That's what I meant by when I talk about a paradigm shift. Because when you back up and when the average doctor realizes that Dr. Berry and Shannon keep talking about checking people's fasting insulin level. I never check fasting insulins. I don't even know why that would help. What does that even do? You're too close to the elephant, doctor. You're not understanding that if you start to check insulin levels in all of your fasting patients, you will be almost like a witch doctor or a psychic. You will be able to predict type 2 diabetes 5 or 10 years before your patient develops it. Yep. And then when you start to understand the power of a low carb, ketogenic, carnivore diet, then you can, when you see that insulin getting up past 20, 25, 30, 35, 40, you can say, you're pre-diabetic. We need to start lowering the amount of carbohydrates in your daily diets. And then when they check repeat fasting insulins at 3 months or 6 months, they can say, oh, look, it's coming back down. Then when they watch the long-term hemoglobin A1C, they can say, wow, it never elevated. It stayed normal. They didn't develop prediabetes. They didn't develop type 2 diabetes. And I think that's what we're really talking about here is we've been taught a way of thinking about diabetes, especially type 2 diabetes. We've been taught a way, and many people would say that that the way doctors and dietitians are taught about type 2 diabetes is affected by the donations from big pharma corporations, big food corporations. There may be some truth to that, but ultimately, this is between the doctor and the patient. This is between the dietitian and the patient or the client. Each of us as individual practitioners of our specialty, we've got to start to look at this holistically, the full picture, and not just say, okay, I'm just going to treat A1C and I'm going to treat, blood sugar. I'm going to treat it with pharmaceuticals. There is another way. There is a better way. There is a cheaper way, cheaper not only for the patient, but cheaper for Medicaid, Medicare, any of the private insurance companies. This way is much, much cheaper, even if you employ health coaches, because the doctor doesn't want to sit there for 20 or 30 minutes. And the dietitian has a little more time to do that. But still, you can't sit there for 2 or 3 hours trying to explain to them what to eat and what not to eat. And so I think health coaches become just a natural evolution of this. I'm the doctor. I kind of oversee. I say this, this, and this, and then I'm going to hand you off to my dietitian or hand you off to my health coach, and they're going to go dive deep into the details, down the rabbit hole, so to speak, and teach you how a human being is supposed to eat. Now, I've been practicing over 22 years. You've been practicing over 18 years. Mm-hmm. You were trained classically as a dietitian. I was trained classically as an allopathic physician in family medicine. What was your kind of first wake up moment that maybe, just maybe, you're standing too close to the elephant and you can't really see the full picture? Can you remember what that was?
Like it's yesterday. So I am an avid CrossFitter. I work out like a maniac. I'm one of these people. I practice what I preach. I can promise you, if I'm going to tell you to do it, I'm going to do it. I like to work out. I eat right. I was doing everything that I was telling my patients to do. Eat every 2 to 3 hours, Dr. Berry, because as soon as I finish my workout, that 60-minute window, I got to get in my protein. I got to eat, right?
Right.
very lean proteins, lots of chicken, rice, steamed broccoli, no fat, fat-free, snack on fruit. I would eat those little pretzel crisp, those, because they're fat-free, right? All day. And I could not figure out, this went on for over 10 years. Every year I'd go get my blood work done. My cholesterol triglycerides were 500. And here's the conversation that's even more sad than that, is the doctor wanted to put me on a statin. Now, statins don't lower triglycerides. So that's
your triglycerides.
That's the first problem. I got sent to a full cardiac workup at Piedmont Women's Heart Institute to figure out why, Shannon, in the conversation, Shannon, you've got to stop eating fried fatty foods. Shannon, you've got, cut back on the butter. And here's myself going, I haven't bought a stick of butter in years. And so at that point, I'm like, something is wrong. This does not make sense. And I picked up Dr. Bickman's book, Why We Get Sick.
Yes.
I picked up, Metabolical, Dr. Fung's book, your book. I literally could not stop. And I'm telling you, there's a few of us I call us rogue dietitians. I actually want to start a Facebook group for rogue dietitians, because we need to stick together. The typical dietitians, when I could show you some really harsh messages, I know Michelle's got some too, of dietitians coming at me saying how, what I'm doing is, how can you practice that way? How can you do that? And, when you don't know, you don't know. But when you know and you still continue to do that, that is wrong. And I think back to what you said, we all have to take responsibility for ourselves. I didn't get taught this in school, but what I did get taught is how to be logical and how to look up data and dig through research. And it doesn't take a rocket scientist to look at our country. 93% of our country has insulin resistance. If what we're teaching worked, we wouldn't be in this situation. But here's the problem. When we go down the rabbit hole or shift our paradigm, I have to admit what I have done my whole career is wrong. And there's a lot of people that will not admit that. That's the problem. I have apologized to all of my patients publicly. I am so sorry for the wrong message, but I did not know. But I know now, and I promise you, if you follow this advice, you are going to get better. I promise. And that's
absolutely. And I think that what you said is very important. Now, I want to just take a break, and I want to ask everybody watching this right now. The American Diabetes Society is a nonprofit society to help people with diabetes live a good, healthy life, not take lots of medications and have lots of complications. So please take a second. This is on the ADS YouTube channel. Take a second, make sure you're subscribed. Hit the thumbs up if you haven't already. And then please, I beg you, share this on all of your social media. If everybody watching this right now shared this on their social media, you would help us reach 1,000 diabetics who do not know this information. This information is not mainstream. It is not what the average doctor or dietitian tells their patients. That's why the average person with type 2 diabetes gets sicker and sicker and sicker and has more complications, has a miserable life, and dies an early death after spending many, many thousands of dollars at the pharmacy, is because nobody knows this. People who understand low carb and keto and carnivore, this, and it feels like sometimes, Shannon, we're preaching to the choir.
Right.
But we have to remember 93% of adults in America have at least one marker of metabolic syndrome. That's over 9 out of 10 adults in the United States. I would guesstimate that 85% of adults in America have never heard a good, thorough explanation of a low carb or ketogenic diet, or how it would actually help them with their prediabetes, with their type 2 diabetes, their type 1 diabetes, their metabolic syndrome, hypertension, fatty liver, obesity. They've never heard somebody who knows what they're talking about explain it to them so they could understand it. So please, everybody watching, share this video as far and wide as you can, and make sure you're subscribed. And we're going to do the best job that we all know how to help. Literally, we want there to be nobody in America who has type 2 diabetes.
Right.
And so if you're a grown adult, if you're like, yeah, I don't care, I want to eat what I want, that's okay. That's your prerogative. That's your choice. But I want every single person with type 2 diabetes to at least know what they should do. And then if they choose not to do it, that's their own business. It's them and their family who will suffer. Let me bring up, I've got the American Diabetes Society webpage pulled up. I want to bring it up and introduce everybody to who we are. Okay, can you see that, Shannon?
I can.
Beautiful. Okay, so the American Diabetes Society, we've got an explanation of all the different types of diabetes, prevention and intervention, type 1 diabetes management, type 2 diabetes, and notice it doesn't say management there. It says type 2 diabetes reversal. And there are so many, there are probably 1 million type 2 diabetics out there who are like, wait, reversal, what? Meal plans, yes, recipes are coming, events and workshops, practical guides. Now, let me show you who we are. So there's this ugly Tennessean. That's me. I'm a family physician, been practicing a long time. This is Professor Ben Bickman. He is a PhD researcher in insulin and glucagon metabolism. I think at Brigham Young, is that correct?
He is.
He's published multiple research studies about insulin, glucagon, diabetes. He's written a book called Why We Get Sick. He is a member of the board. I'm a member of the board. Professor Bickman is a member of the board of directors. This is Dr. Mariella Glant. She is a board certified endocrinologist specializing in diabetes, type 1, type 2, MODY, LADA. She is an expert on all that. She is one of the founding board members of the American Diabetes Society. This is Dr. Tony Hampton. He is a obesity medicine specialist, primary care doctor in the Chicago area. He has been practicing medicine for longer than me, way over 22 years. He is a founding board member of the American Diabetes Society. This is Michelle Hearn, registered dietitian and author. What's the name of her book, Shannon?
Dietitian's Dilemma.
The Dietitian's Dilemma. If any dietitian's watching this and you're like, well, I sort of get it, but I don't know, read Michelle's book. She's a registered dietitian. She's helped so many thousands of people with eating disorders, with diabetes and other things. This is Dr. Professor Eric Westman, an internal medicine doctor and obesity specialist. He's in the Raleigh-Durham, North Carolina area. He practices at the Duke University Medical Center. He has been practicing medicine probably longer than all the other doctors put together. He worked side by side with Dr. Robert Atkins when he was still alive. He has published many, many research studies about low-carb diets and ketogenic diets. And then we have, this is Shannon, right here, Davis, in the Atlanta, Georgia area. And you also practice online?
Correct.
As well, correct? Okay. She's a registered dietitian, been doing this for way more than a decade. This is Shanna Husson, who's also a registered dietitian, nutritionist. I don't know what part of the country she's in, but I think she also has an online presence. And then this is our attorney, Jack Nichols. He's in Texas. And then this is our other registered dietitian, Temple Stewart, registered dietitian. She's very active on social media. She's working on a book, I hear, right now. And she's constantly on social media helping people understand diabetes, what you should do, what you shouldn't do. And I think that the dietitians are probably the strongest link for the American Diabetes Society. And then let me show you one other thing up here, right up in the top right-hand corner. We are a brand new nonprofit organization, and we are trying to raise money so that we can fund research, so that we can get research studies published, so that we can help young doctors and young dietitians who understand a low carb, a ketogenic, a carnivore diet, and how it can help someone with diabetes so much, please consider even just a small donation. Just go to AmericanDiabetesSociety.org and click that button in the top right-hand corner. All right, Shannon. Sorry about that. We needed to do that and get that out of the way. So I think a bunch of people have shared this. If you haven't already, just click the share button and share it out there, because there are people suffering with diabetes. They do not know there's an answer. 93% of people with diabetes have type 2 diabetes, which, as you saw on our website, we help you not manage that. We help you reverse that. So if we've got somebody currently, Shannon, with type 2 diabetes watching this, and then also I want to tell you guys watching, if you have a question, we're happy to answer your questions about diabetes, of course. Just type 3 capital Qs or the all caps word question, and then type your question in. Try to keep it as short as you can. And we will bring your question up on air and answer it live. And then both of us will probably be in the comments if you're watching the replay of this. If you're someone with diabetes or love someone who has diabetes, type your question into the comments if you're watching this on the replay, and both Shannon and I will be watching that, and we'll try to answer all those questions. So let's just say we've got somebody who just tuned in and they're like, oh, this is a doctor and a dietitian. They're talking about diabetes. I have type 2 diabetes. Wonder what they're going to advise me to do. You're the dietitian here. So let's start from just the first principles. They've been told to eat Mediterranean, or to eat the rainbow, or to eat less and move more. So they really haven't been taught anything about nutrition. Let's start at the very beginning, the training wheel stage, the romper room stage. And let's say, okay, you got type 2 diabetes. Here's what I want you to start doing, and here's what I want you to stop doing.
Right. So first off, I like to get a good diet recall. I'd love to find out what people are eating. And, unfortunately, there's so much information out, and these food manufacturers have made marketing where people think these foods are so healthy. Oat milk is a great example. You see it advertised. It's got all this beautiful packaging, acai bowls, smoothies are hailed as this all healthy thing, and people are going to have it in the morning thinking that they're doing their body a good. Oatmeal is another amazing one. And so I get a dietary recall, and then I go through that, and really I instruct them that type 2 diabetes, like we mentioned earlier, is a disease of carbohydrate toxicity. Your cells cannot handle any more carbohydrates. Carbohydrates are the macronutrient that elicit a glucose and an insulin response. So
the 3 macronutrients are fat, protein, and carbohydrate. And so you're saying that type 2 diabetes is a carbohydrate overdose syndrome, or a carbohydrate toxicity situation. It's not that they're eating too much fat or even too much saturated fat. They're definitely not eating too much protein. If you have type 2 diabetes, you're currently eating too many carbohydrates for your personal physiology. Is that right?
It's correct. I like to, give the metaphor of, like, you have a suitcase, and women are the worst. When you're trying to travel, you want to pack everything in that suitcase. It's overflowing. We sit on it. We try to zip it up, and you've got clothes coming all out the side of the suitcase. So in order to make that suitcase carryable on the airplane, we got to remove some clothes. So if we can get insulin down, we can start to utilize some of that energy or those stored carbohydrates in that cell and clean them out. The cell becomes less inflamed. The cell becomes more sensitive to insulin. The less carbohydrates you take in, the less insulin that your body needs. That's the goal. The goal is to increase our insulin sensitivity and get it down. So if we focus on the foods that don't elicit an insulin, as much of an insulin response, such as protein and fat, guess what? We're not telling you have to eat less. We're not telling you that you have to follow a diet that's distasteful. To me, there is nothing more yummy than a big, juicy burger with bacon, cheese, and an egg that's dripping out of your mouth. And guess what? You just leave the bun off. And so when people learn that they can have these amazingly tasty foods, and again, I'm not telling you, I don't ever want you to be hungry. I want you to eat till you're satisfied. You find out by default that you don't need to eat all day. The fact that we need to eat every 2 to 3 hours is a myth, right? We wouldn't be here. Our ancestors would have died off this planet if you had to eat every 2 to 3 hours. So
Yep.
you eat less, and guys, fasting's free. So you're saving money and you're healing your body. And when you just focus on one ingredient foods, eggs, butter, beef, chicken, fish, pork, lamb, and if you want vegetables, focus on those high in fiber, your body starts to heal. You're getting all the nutrients, the inflammation comes down. I have people that have told me within a week, the tingling that they have felt in their feet is gone. It's
Yes.
gone because you're
Yes.
lowering the inflammation. And I think if you'll just give it a shot, you mentioned, I do everything virtually. I make social media posts, I educate. My comments, my messages blow up every day on people saying, I cannot even believe that my doctor has never told me this. Because of
Yeah.
what you
Yeah.
told me, I am off. We have a guy was 426 pounds on 25 medications, Dr. Barry. In 6 months, he's down 110 pounds. He's off of 23 medications,
Yep.
and he's never felt better in his life. And guess what did it? Real food and fasting.
Yep.
It's amazing.
I think that modern medicine, which I'm still licensed and board certified. I still have a small practice, but I spend a lot more time educating on social media than I do in the clinic anymore. But I think that what happened was medicine was almost seduced by the pharmaceutical industry. They, as you know, they paid for many buildings at the medical campus. They pay for and sponsor, and they used to give away. I can remember I got a huge family medicine textbook, like a $500 textbook from the Rocephin rep.
Oh,
They brought lunch, and I was a third year resident, and they're like, "Hey, do you have a copy of this?" And I was like, "Oh my God, I would love to have a copy of that." And he's like, "Here you go." Gave me a $500 book. Now, wonder why the word Rocephin rolls so quickly off my lips, because I had a crush on the Rocephin rep after that, because they gave me a book that I, as a poor resident, could not afford. So many doctors have went down this road of just being subtly, seductively led off the right path. And many of them now, like you mentioned earlier, they're so far off the path. They're so lost in the pharmaceutical jungle that to turn around at this point and go back and find your way again would hurt. It would be very mentally painful, psychically painful, like literally mental anguish to, first of all, have to admit, I've been doing this wrong for 5, 10, 15, 20, 25, 30 years. I've got to go all the way back there because I took a wrong turn. I went down Pharmaceutical Boulevard, and obviously the ADS were 100% in support of using medications wisely and diligently in the proper situation. But just to blindly throw pills and injections at people, I think those days are quickly numbered. I think they're coming to an end here in the near future. But I think it's similar in the field of dietetics, is it not? That you guys were so mistrained in school. The textbooks often sponsored by Kraft or Kellogg's or
the American
Mondelez.
Dietetics Association is sponsored, by Nestle or our big, huge meat. I don't go to them, but they're all sponsored by, snack foods, Nestle or Kraft or Abbott. I mean, in working in dialysis, we gave out Nepro, which is, if you flip it over, it's like high fructose corn syrup and canola oil. These are the most inflamed people on earth that have kidney failure. The two main causes are diabetes and hypertension. We are feeding you the poison that got you there. And it's all pumped by, and look, I worked in pharmaceutical sales. I did an expense report every weekend of sometimes $5,000 a week in food that I would bring to
Yeah.
these offices to talk to the staff and the doctor about why. Now, the way I swallowed it is I promoted a life-saving medication for somebody on dialysis. So I
Yep.
literally believed in it and could stand behind it because it was necessary. But it doesn't mean that the industry as a whole isn't just sick, you know?
Well, they're profit driven. And if you're working for a board of directors and shareholders, your legal duty is to increase profits. That's literally what you're supposed to do. And so I think that our job is to just tell people there's another way, there's a better way, there's a way that works. Let's not get into it today, but in the future, on a future live, I want to ask you the tips and tricks and strategies that your regional manager taught you as a drug rep to become close to doctors. And I know also you guys are trained to become very close to the office manager and the nurse manager, because they are basically the gatekeepers. But let's not get into that today. I want to really focus on helping people with diabetes. But I think many doctors think, no, that Shannon Davis, the drug rep for whatever drug that was, we're just really good friends. She really likes me. We really just clicked, and she's beautiful. She's a great person. And we just hit it off. And I bet none of those doctors realize that you have had a literal playbook that you went by. Probably the drug rep that you inherited that territory from probably had a list of notes about every single doctor, office manager, nurse manager. Like, she likes this, he likes that, they love to do this, they don't like food from this restaurant, but they love food. Like, you had cheat notes going in the door, did you not?
Absolutely. And I passed those on when I walked away to do my own practice. I couldn't do it anymore.
Yeah. So if any doctors or dietitians, doctors, nurses, office managers are listening, the drug rep really doesn't like you that much. They didn't really click with you like you think they did. They had cheat notes. Okay. They knew all about you before they walked in the door. They knew your hobbies. They knew how many kids you had. They knew if you had a dog, or if you're a dog person or a cat person. You need to know that. And then that helps you look at it in a new light. Now let's get back to our person who's just been diagnosed with type 2 diabetes. They got an A1C of 10 or 11. And the doctor started him on metformin. They started him on 2 other medications. And they said, if we can't get this down in a few months, we're going to have to start you on insulin. Now, the doctor actually referred them to a dietitian, and a traditionally trained dietitian. And that dietitian showed them a lot of information. They gave them a handout from the other
their carb count.
From the other diabetes association. And they said, you got to stop eating honeycombs for breakfast. From now on, I want you to eat whole grain cereal only. I want you to use skim milk because whole milk has too much saturated fat. I want you to drink a glass of orange juice because it's got lots of vitamin C. I want you to eat 1 or 2 pieces of whole wheat toast, not that bunny bread, not that white bread, but real brown whole wheat toast. And don't put butter on it because it's got too much saturated fat and cholesterol. Put margarine on it instead. Or you can have a fruit juice smoothie, or you can have a fruit bowl, right, with a yogurt that's lightly sweetened. Yeah, with lots of granola, because that's whole grain as well. That's the advice that this person was given. Where's that advice wrong, and what would you recommend instead?
Number one, where is it wrong? It's all carbohydrates. Remember, if you have type 2 diabetes, you do not tolerate carbohydrate. You cannot eat them. It's making you sick. It's why you can't get better. If you're just so confused because you're doing everything your doctor told you to do and you're taking your medicines properly, but your A1C isn't going down, it's that reason. That is the reason. So what I tell people is we need to remove the carbohydrates. We're taking, but we're not telling you have to starve. We're not telling you need to be hungry. We're just changing the food around, right? And so we want to focus on proteins and fat. fiber first. If you're going to eat carbohydrates, fiber first. Don't fear fats. Prioritize protein and frequently fast. People are afraid of fasting, Dr. Barry, and
Yep.
fasting is an amazing tool. It's one of the best things. I can't tell you how many diabetics, people with diabetes that I work with, tell me that they can't fast because they have diabetes.
Right. And they've been told that by their doctor and their dietitian. Now, for anybody watching with diabetes, if you're currently injecting insulin or you're taking a sulfonylurea like glipizide, glimepizide, then you need to talk to your doctor or your dietitian or your health coach before you really start to fast for longer than 16 or 18 hours.
Right.
But once you get the medication situated and you are working with a dietitian who understands a low carb or a ketogenic diet, or a doctor who understands it, you absolutely can fast, and you can benefit from fasting greatly. In many cases, for many people, Shannon, just fasting 16 or 18 hours a day, every day.
It's perfect.
It works wonderfully, and it doesn't cause any problems. And if you're eating enough fat and protein, you're not going to be starving to death like you imagine that you would be. So this breakfast I described, what would you say instead of the whole grain cereal with skim milk and the whole wheat toast and the glass of orange juice? What would you recommend instead for their most important meal of the day?
Absolutely. Eggs. And guys, please eat the yolk. The yolk is the most nutritious part of the egg. So real eggs, right? More than one, more than two, maybe four. It's perfectly fine. Cook them in real butter. Actually, have some bacon and cook the eggs in the grease that's left in the pan from the bacon. Make a big omelet with ham and cheese and mushrooms if you want to put bell peppers in there with the full egg, right? So any type of meat, any type of fat is going to keep you very satiated. Your blood sugar is not going to spike. And what you're going to notice is, normally when you're like, it's 2 hours and you're like, I'm ready for my snack, you're going to be like, well, wow, I'm not even hungry. Yep. And you're going to notice that over time. And one thing I want to point out, Dr. Barry, is guys, when you make these changes, it's not going to be automatic. It's going to take some time for your blood sugars to come down. Remember, you've got a lot of stored sugar in your body that's going to have to be pulled out. Remember, we got to take that clothes out of that suitcase. So your glucose may not be completely normal yet. But as we work through this and your body starts to burn that, it's been shoved in a lot of places it doesn't need to go. And you're going to start to see your glucose come down and stay down. You're going to start to feel better. Your energy is going to be better. Your blood sugar your blood pressure, because as you learn and we teach you, blood pressure is not a salt problem. It's an insulin problem. And your whole health, migraines, thyroid problems, PCOS, erectile dysfunction, fatty liver. Guess what? All of these things are going to get better by you removing that toxic carb agent right there.
Yep. I love that. So if somebody's like, I don't know about bacon, I don't know about that, and I can't afford steak, then you can just make a big 4-egg, 6-egg, 8-egg omelet. You can chop up some bell pepper. That's got way more vitamin C than a glass of orange juice and way less sugar. Again, that's another win for somebody with diabetes. You can chop up some mushrooms and put in there a little bit of ham, a little bit of some kind of meat if you want to do that. It's not even required that you do that. All kinds of little low-carb vegetables you can chop up and just make the biggest loaded omelet you've ever eaten in your life. That loaded omelet is going to be full of healthy fat and full of healthy protein, and it's going to be very low in carbohydrates.
Here's one thing I left off, Dr. Ben,
yes,
is people really want their coffee. So instead of that orange juice, guess what? Keep your coffee and put heavy cream in it. What is more wonderful than a cup of coffee with heavy cream?
Absolutely. And when she says heavy cream, she means heavy cream, whipping cream, double cream, depending on where you live. People call it different names. We are not talking about all of the brand name coffee. What are they, like coffee creamers
Coffee mate,
that have
whatever.
mocha and flavoring and sugars and vegetable seed oil? She's talking to you. Buy this in the dairy section. You can buy a little pint or you can buy a quart. It just depends. It's up to you. But that in your coffee, that's very healthy fat and a little bit of healthy protein. That's going to help keep you full for hours after you eat this the heart healthy diabetes reversal breakfast of this loaded omelet. That's going to do it. And so you're going to get your vitamin C from the little bit of bell pepper. You're not going to get it from the big glass of orange juice because that's full of sugar too. Obviously, the American Diabetes Society doesn't want you to drink a Coca-Cola or a Pepsi for breakfast. You know that's full of sugar, but there's many people out there, Shannon. If you said, orange juice or apple juice or grape juice or even grapefruit juice, if you say that's just a glass of sugar with a little bit of vitamin C and maybe a few other vitamins and minerals and polyphenols, they'd be like, no, I squeezed this orange juice myself. This is fresh, non-GMO, organic orange juice. Yeah, it's still full of sugar. And if you have prediabetes or type 1 or type 2, that's too much sugar for your system.
I'm glad you brought that up because I get the question. People struggle with fruit more than anything else because fruit is natural. We should eat fruit. It's healthy. And I'm not saying that fruit does not have vitamins and minerals and antioxidants and polyphenols and good things in there, but you have to understand what a fruit is. Fruit is meant to be super sweet, and it's got the seeds in it because the plant wants us to eat the fruit and eat a lot of it so that we can poop out its seeds and spread it across the world, right? That's why it tastes so good. But y'all, it's still sugar. Your body sees an apple, a grape. Grapes are one of the most highest sugar. I call them a sugar bomb. Your body's going to see the grape in a sugar cube. Now, the grape may have just a wee bit more fiber, but it's going to metabolize it the same way. It's going to metabolize it the same way as it does any other sugar, a grain of rice, a thing of pasta. Just because it's fruit, I have people, it's natural. You know what? Rocks are natural, but we don't eat rocks.
Right. And so, grapes and raisins confuse people more than I think any other fruit because they're marketed as, natural and they're fruits. That's all true. But for somebody with prediabetes or any version of diabetes, that's just too much sugar at once. Now, some people can reverse their prediabetes or type 2 diabetes eating just a low carb diet with under 100 total grams of carbohydrates a day, in which case a limited amount of fruit, absolutely fine, as long as you don't go over 100 total grams of carbs a day. Some people can reverse their type 2 diabetes using that. And so,
and then if they move, if they walk for 10, 15 minutes after they eat, they can even eat a little more.
Absolutely. And so I want to be very clear about this. Although Shannon and I understand and recommend a carnivore diet for many, many people, that is not necessary for everyone. I think that there are many people who can control their type 1 diabetes or completely reverse their type 2 diabetes with a low carb diet under 100 total grams a day. For many, many people, millions of people, that's all they need to do is cut the carbs down to under 100 total grams of carbs a day. That's going to fix their diabetes or their prediabetes if they're type 2. And then some people who fatten very easily and their blood sugar just skyrockets if they even look at a carb, they need to cut it down to maybe 50 total grams a day. Some people need to go ketogenic and cut it down to under 20 total grams a day. And I do believe that there's a subset of people, maybe 10, 15, 20%, who need to cut it down as close to 0 carbs a day as they can. And that's what a carnivore diet is. All of these diets are very nutrient dense that Shannon and I are talking about. you're going to actually be getting more vitamins and more minerals by eating low carb, keto, or carnivore than you're going to be getting from eating that whole wheat bread and that bowl of whole grain cereal and that glass of fresh squeezed orange juice. You're getting less nutrition from that breakfast than you would be from that loaded omelet that has all of these real whole human foods in them. Now let's go to lunch, Shannon.
Yeah.
So we've educated this person about their breakfast, and they're like, "Oh, I love loaded omelets and full fat cheese. You can put that in your omelet as well." Now let's go to lunch.
Yeah.
For lunch, they've been having a small piece of skinless, boneless chicken breast.
Mm-hmm.
That's what the dietitian told them, and they're having a serving of rice, steamed rice. Though it's not steamed because that's somehow magically better. And they have a serving of steamed broccoli as well. And then they're having some cookies that they found a recipe for on the other Diabetes Association's website. But it's literally on their website how to make these cookies.
Yeah.
And so they've been making those cookies every day. Now they didn't look very closely because it says that the serving size for that is one small cookie. But what adult human eats one small cookie for dessert? So they've been having 2 or 3 of those cookies after lunch, as it's diabetes approved dessert. And they just drink a Diet Coke or Diet Pepsi with that because they're sugar free. What problems do you see with that lunch, and how would you rectify those problems?
Yes. First off, I just want to let people know I eat this way and I'm not diabetic. I follow this same eating recommendations. I probably eat 50 grams of carbs a day. I intermittent fast 16 to 18 hours a day. So even for those of you who are listening that don't have diabetes, you can eat the same way as we're recommending so that you don't ever get diabetes. But if you have someone in your household, we can all eat the same way. These foods are amazing. But for this person that's going to eat lunch at their office, what I would recommend is to find a protein that they like. If they like chicken, then let's do a chicken thigh and let's leave the skin on it. Beef, ground beef, you can cook up some ground beef. And here's the beautiful thing, guys. When you're not buying the 96 lean, the 80-20, which is better for you, is cheaper, right? So you're going to have some ground beef that you've cooked up or a steak that you ate for dinner last night. And guess what? When you're not buying the filet, now I love me a good filet, I'm not going to lie, but there's, sirloin and ribeye and the cheaper cuts that have more fat are actually better for us. So you may want a piece of fish, you may want an egg salad, right? But use real mayo that doesn't have seed oils. So you're going to make your meal around your protein source, and then you can have some vegetables with it. There's nothing better than bacon roasted Brussels sprouts or
so good.
Broccoli with butter or broccoli with cheese or asparagus, or even like you've made fajitas, sheet pan fajitas with bell peppers, onions, steak, and then cover it with guacamole and some full fat, real sour cream. So really what you're doing is anything that you're eating, you're just removing the carb part of it. So even that meal that you said, Dr. Berry, what I would do is I would add some butter to that chicken and that broccoli and probably add, a chunk of cheese or, to make it more fatty and more protein. And then you could even add an avocado and a hard-boiled egg and full-fat Greek yogurt, and you would have an amazing meal. And then when you're done, if you can stop your meal 10 minutes early, right? We all want to sit and scroll. But if you go walk around the parking lot or the parking deck and make your muscles work, you can utilize that glucose into the cell without the need for insulin.
Yep. Even just a 10-minute brisk walk, the last 10 minutes of your lunch break will open up your muscles and allow them to pull in so much of the because there's going to be glucose if you eat any carbs at all. And if you don't eat any carbs, then your liver will make glucose. But you can pull any extra glucose into your muscle cells just with a 10-minute brisk walk. And if you're currently bad out of shape, then that's fine. You can start with literally a 3-minute walk and build your way up. So I love what you said about, and here's another very important thing, because for most diabetics, they're taught that portion control is literally the end all be all, right? You can have just a palm sized portion of just one skinless chicken breast. But when you start eating low carb or keto, portion size ceases to matter, especially with the fat and the protein portions. And so if you're like, yeah, I eat the chicken breast and the rice and the broccoli, I'm hungry an hour later. And so I wind up eating 3 more of those diabetic cookies because I'm starving to death. But when you start to eat the way Shannon's recommending, you can have 2 chicken legs with the skin on, or 3 or 4. You can have 3 chicken thighs with the skin on. You can double that broccoli portion and put butter on it and just get rid of the rice, because the rice has no meaningful nutrition and it's going to shoot your blood sugar sky high. And then you're gonna have unsweetened tea to drink, or you could have another coffee at lunch if that doesn't interfere with your sleep. It does for some few, but most people can have it at lunch. And then what about if they're just like, I got to have something sweet at the end of my meal, Shannon? Well, I've got to have some little chocolate or some little sweet. What can they do?
So I would tell them to get some berries, blueberries, blackberries, strawberries, raspberries, and have it in a full fat, unsweetened Greek yogurt, or even a square. Dr. Mariella loves the square of real dark chocolate.
Yeah,
not the sugar sweetened kind. But
not Hershey's.
Right. I had a patient tell me the other day that the Hershey, that the Reese's peanut butter cups counts, that Dr. Mariella said, and I'm like, no.
No.
But as you start to eliminate some of these carbs and the sweet, you'll be amazed at how sweet real food tastes. Like heavy cream in your coffee will actually be sweet. These berries will be so tasteful, and that square of dark chocolate is going to be amazing, and it's going to satisfy you because you're already full.
I love that. That's such great advice. If anybody watching, if you have a question about diabetes in particular, or if you have a success story where you use low carb or keto or carnivore to reverse your prediabetes or type 2 diabetes, put that in the comments and we'll bring your comment up on screen. I want to see what your before and after A1C was. There's so many people watching saying, love this video. Keep it up, Shannon. Absolutely. I love it. Now, BBB and E, for people who don't know, that stands for beef, butter, bacon, and eggs. And that's just a very simple way for people, if they're like, I don't understand this low carb, what's allowed, what's not allowed. This keto thing, I mean, I don't know. They got keto bread at the store. They got keto pancakes. I don't trust that. If you want to just do 90 days of carnivore while you're kind of getting your low carb legs situated under you, you can just eat beef, butter, bacon, and eggs. And you can eat that once a day, twice a day, 3 times a day. That is about as low carbohydrate as you can get. And you can put salt and pepper and some other little spices as long as they're sugar-free or relatively so. You can always put some butter on it because butter is a healthy fat. But a lot of people in the low carb community, they have to eat something like beef, butter, bacon, and eggs to keep their type 2 diabetes completely reversed. Many people don't. And so if you're like, that's all meat and eggs, I don't want that. That's totally fine. There are other options for you on the American Diabetes Society website. Tell people about some of the recipes that you and the other great dietitians have coming that will soon be on the ADS website.
Awesome. Absolutely. One other thing I wanted to throw in there that you mentioned is, guys, as you start eliminating carbs, insulin is high. Insulin will come down. Insulin makes the kidneys hold salt. Your kidneys will release that salt and you're going to start urinating a lot. It is super important that you eat salt. I mean, and I'm not talking about the little blue carton with the umbrella girl. Like, Redmond's real salt, Celtic sea salt, pink Himalayan salt, because you need electrolytes. Super duper important. Okay. So when Dr. Berry said use salt, people laugh at me. I bring my own little Redmond's real salt shaker with me because those little salt packets have dextrose in them. Be careful. It's crazy.
Yeah. Umbrella Girl salt has literal sugar in the salt. She's not kidding. This is true.
Ridiculous.
You can look it up. Yes.
I just can't even. But our recipes, y'all, we have so many exciting recipes coming. They're simple. They're going to be with ingredients that you have at home, but we have desserts in there. We have like, I can tell you some that I put, like cauliflower mac and cheese, where, cauliflower mashed potatoes. And I'm telling you what, if you mash some cauliflower and add some heavy cream and butter, it is amazing. But we have, crock pot meals that people can cook and go. We have some breakfast casseroles. But there's some different salads in there. We have something for everybody. We have some vegetarian recipes in there. If we have vegetarians, we don't want to exclude y'all.
Yes.
We have recipes with eggs. We have tons of fish recipes, different ways to cook fish. I think you're going to be very satisfied because they're all super easy, and they're going to be with ingredients that you already have at home. So none of these special ingredients, and they're all going to be that your family can eat. And no one's going to know that it's low carb. They'll eat it up, I promise. So
absolutely. Here's a good story for everybody. So Rich has LADA. So he has late adult onset type 1 diabetes, essentially. Before he started the carnivore diet, his A1C was 9.6, which is very high. He was at super high risk of diabetic complications, losing a toe, losing a foot, losing kidney function, losing vision, losing function below the belt, heart attack, stroke, fatty everything. Liver. Yeah, fatty liver, huge risk of that. Now, after just a few months on carnivore, his A1C is down to 6.2. His triglycerides went from 990.
Insanity.
Down to 1. And that's so high, that puts you at risk for pancreatitis.
Yeah.
Huge risk. Now that his triglycerides are down to 105, and this isn't a type 1 adult onset.
Crazy.
So this is a huge. Rich is now so much healthier. His risk is so much lower for literally hundreds of medical complications and diabetic complications. I can't stress enough how much healthier Rich is now than he was before. Here's another one. Jan, thank you, Dr. Berry. A1C was 7.4, so well over the type 2 diabetes limit. Now down to 5.2. Goodbye,
no more diabetes.
See, Jan used to be a type 2 diabetic,
correct.
But now when Jan introduces herself, she doesn't say, "Hi, I'm Jan and I'm a type 2 diabetic." She says, "Hi, I'm Jan and I reverse type 2 diabetes." And if Jan can do it, I promise you and your family can do it as well. Doctor, put in my file that diabetes was reversed. Now, some doctors have a problem with that, but her doctor it's absolutely appropriate that her doctor put that in her medical chart. Now, let me just stop one more time and say, guys, we're a brand new organization, the American Diabetes Society. We need your help to reach people who do not know this. They can't have access to this video if they don't know this video exists. So please make sure you're subscribed to this channel. This is not my YouTube channel. This is the American Diabetes Society channel. Make sure you're subscribed, hit the thumbs up, and please share this all over your social media. There are millions of people with type 2 diabetes in the United States, and they do not know about low carb. They do not know about ketogenic. They do not know about ketovore. That's another little sub way of doing this. They do not know about a carnivore option. We can teach them about that through the American Diabetes Society, through our social media,
for free,
100% for free. That's right. You don't have to sign up. You don't have to do anything. Now, we really do. We do ask you to go to the American Diabetes Society's website and click the button right up here in the top right that says donate today. $1, $5, $10, whatever you can afford. We need your donations right now. We hope to one day be self-sustaining and not have to beg for money, because none of us are comfortable begging for money, but that's what you have to do when you're a new nonprofit startup. You have to beg for money. And so please, just a small donation would go so far towards helping us help people with diabetes to realize a level of health that they never even dreamed was possible. As we come to a close, Shannon, tell us, let's do dinner. We've already did breakfast and lunch. And so they've been having a vegetarian dinner because they've been hearing lots of stuff about plant-based, how that's best for people with diabetes, how that's probably best for the planet. That's probably the healthiest option. And so they just have 3 different vegetables, and then they have some kind of little sherbet. Some kind of sherbet, because they heard sherbet was better than ice cream somehow. And so, yes, help walk them through dinner or supper, depending on where you live in the world.
Right.
And let's talk about what they can do better than that.
Right. First off, if you're not hungry, you do not have to eat. And I want to say that very loudly, because I hear so many diabetics that I work with that say they have to eat 3 meals and 2 snacks because their doctor told them, because they're diabetic. As you drop carbs and your body starts burning its own fat for fuel, you may not be hungry. We get energy 2 ways, this way and from our love handles. And so if you are not hungry, you do not have to eat. Now, adjust your medication properly per your doctor. Do not give medicine if you're not eating. Okay. But for dinner, I would tell you to eat the exact same way as you're going to eat for lunch. Protein, like it's coming out your ears. Fat, don't fear fat, right? We want to eliminate the seed oils and focus on animal fats, saturated fats, butter, tallow, lard, right? Coconut oil, avocado oil, olive oil, those type of fats. And then some high fiber vegetables, right? And in a perfect world, you would eat at least 4 hours before you go to bed too.
Yes.
You know, that's really important. Eat, walk to the mailbox, do some air squats while you're cleaning up the kitchen. You're going to pull that glucose in to those cells, and you're going to have a nice stable night. There's nothing worse than spiking your glucose, bottoming out in the middle of the night and not sleeping. So if you keep it high fat, high protein, high fiber, you're going to be amazed. You're going to be amazed.
I totally agree. Shannon, thank you so much for doing this with me today. I know that you're called, just like I am, to help people with diabetes all over the country, and indeed all over the world, because this information is free regardless of what continent you live on. You've got complete access to everything for free at the American Diabetes Society's website. There's a link in the show notes to that website if you want to check out what we've got. Like I said, we're a new organization. We're adding stuff to the website every day. There's hundreds of recipes coming. So make sure and bookmark the website. Make sure you're subscribed to this YouTube channel. The American Diabetes Society is also on Facebook, on Twitter, and on Instagram. And I think maybe on TikTok too. I'm not sure about that. But we're everywhere that people are, because people are who we're trying to help. Mm-hmm. Thank you so much, Shannon. Any final words of wisdom?
I just want to let everybody know it is possible. You can do it. And the idea that you've had ingrained in your head that this is a chronic and progressive disease, that you're just going to have to live with it, that's not true. It's not genetic. Our environment determines what we get, really. And so if you adopt this, just have some grace, be patient with yourself, and be consistent. And you're not going to carry, the diagnoses, just like these people, the comments. Rich, you're not going to carry these diagnosis codes anymore. You're going to be healthy.
That's right.
But everybody can do this. Every single person on here these are dietary diseases. Medications won't do it. They're Band-Aids. So if we focus on what caused it, which is, we caused it on ourselves with how we ate, we can uneat our way out.
Absolutely. And everybody watching this, keep in mind,
Mm-hmm.
the only way we can help your granddad or your grandmom or help your mom or dad or your aunt or uncle
Mm-hmm.
is if they know about the American Diabetes Society. And the only way they may ever hear about it is if you share the good news with them. So please share this with everybody you know who's currently has diabetes, and let the American Diabetes Society help them improve that in a way that they never even dreamed was possible. Thank you, Shannon, so much.
Thank you
See
so
you
much.
guys next time. Bye-bye.
Bye-bye.